Yo, my good people. Hopefully you've had a good day. It's your good nurse again, Felix Andotu, the father of the new generation rationale-based nursing. And today I just want to do a continuation of the previous video that I did on hypertensive disorders in pregnancy. And today I'll actually be talking about the most common and the most fatal form of hypertension in pregnancy, which is preeclampsia and eclampsia. I don't know, guys, if you've ever come across the word preeclampsia or eclampsia, or maybe have you ever gone to a maternity unit and then you hear that a certain patient has been diagnosed with a special form of hypertension called preeclampsia or eclampsia. And by the way, preeclampsia and eclampsia is actually the commonest and the highest in prevalence of all the hypertensive disorders in pregnancy. So I'll actually talk about this particular condition in different subheadings. I'll define what preeclampsia is. I'll actually talk about the risk factors of preeclampsia. I'll talk about the pathophysiology, or rather the pathogenesis of preeclampsia. I'll talk about the clinical manifestation. I'll talk about the classifications and of course the complications and the management, the principles in management of preeclampsia. Without further ado, let us run it up. Preeclampsia, to start with, basically, it is defined as a form of hypertension in pregnancy that is clinically defined by elevated blood pressures of more than 140/90, accompanied by other systemic symptoms like proteinuria, pathological edema, and other systemic symptoms. So preeclampsia, it refers to hypertension in pregnancy that is characterized by elevated BPs of more than 140/90, plus but not limited to proteinuria, pathological edema, and other systemic symptoms, which normally has an onset from the 20th week of gestation and usually ends by 6 weeks postpartum. So the key words in defining preeclampsia: first, it is hypertension in pregnancy, characterized by elevated BPs of more than 140/90, with proteinuria and pathological edema, has an onset from the 20th week, and usually lasts up to 6 weeks postpartum. Yeah, what are the risk factors of preeclampsia? Some of the risk factors of preeclampsia include: one, previous history of preeclampsia. Of course, we have the multiparity. We have the extremes of age. Yeah, we have also nulliparity. We have diabetes, obesity, chronic hypertension, renal disease. Yeah. There is a lot that can lead to preeclampsia, but the exact cause of preeclampsia is actually not established. And without forgetting another risk factor, we have the black race. It's actually more prevalent in Africans than the whites. Okay, after that, I'll directly go to the pathogenesis, or rather the pathophysiology of preeclampsia. How does it develop? And that is the biggest question. So preeclampsia, primarily, the exact cause is not well known, but its pathogenesis is believed to be emanating from an abnormal placenta, in quotes, an abnormal placenta. Usually, under normal circumstances, when the placenta forms, there is something we call the trophoblasts. They usually invade the arteries, that the blood vessels that supply the placenta with blood. That is the spiral arteries. So the trophoblast, after invading the spiral arteries in normal circumstances tend to widen. Then after widening, they increase the supply of material, that is blood, nutrients, into the placenta. But in preeclampsia, there is development of this an abnormal placenta. And this abnormal placenta usually results as follows. One, there is incomplete invasion of the trophoblasts into the spiral arteries. When the trophoblasts fail to invade the spiral arteries tend to narrow. When they narrow, what happens? The blood supply to the placenta is diminished. When the blood supply to the placenta is diminished, the placenta becomes ischemic. When it becomes ischemic, there will be an inflammatory response, whereby the placenta will tend to release some inflammatory mediators, what they used to call, long ago they used to call toxins. That is why sometimes back preeclampsia was known as preeclampsia toxemia, PET, but nowadays we don't use that. So those toxins, once once the spiral arteries get narrowed due to incomplete invasion of the trophoblast, the blood supply to the placenta is actually diminished. The placenta becomes ischemic, and as a form of response, it releases some toxins, what we call inflammatory mediator toxins. These toxins tend to either domicile in the placenta, and after some time they get released into the maternal circulation. So when they remain in the placenta, they cause something we call endothelial damage in the placenta, and the blood supply and supply of materials to the fetus get diminished, and the fetus will actually manifest with intrauterine growth restriction, and to some extreme, when it gets to very extreme ends, it can even cause intrauterine fetal death to the fetus. Yes, and when these mediators actually get into the maternal circulation, it leads to widespread endothelial damage and widespread endothelial vasoconstriction. It also causes something we call, of course, the three main effects of endothelial damage will be vasospasms and ischemia. We have something we call capillary leakage and thrombotic sequel. Yeah, those three main. And when these mediators now get into the maternal circulation, they cause that widespread endothelial vasoconstriction. And once the blood vessels get narrow or vasoconstrict, the ripple effect will be the blood pressure will be high, and that is why the cardinal sign of preeclampsia is hypertension. Yeah, and once the blood vessels get narrowed to different body organs, means that those organs will actually get diminished supply of blood and materials, and now the reduced blood supply to the kidney will cause kidney damage, or rather glomerulus damage, which will lead to some of the effects on the renal system, such as proteinuria, and all those other systemic symptoms. When the blood supply to the liver is diminished, we'll have things like hemolysis, elevated liver enzymes. When the blood supply to the brain is diminished, it can even cause seizures. Now, what we will call eclampsia. When the blood supply to the eyes will cause reticular damage, what we call which will lead to blood vision as one of the signs and symptoms of preeclampsia. Yes, that is on the pathophysiology. Next, we'll look at the clinical manifestations. What are the clinical manifestations of preeclampsia? The hallmark signs of preeclampsia, we have one, hypertension, which I have explained in when explaining the pathophysiology. Hypertension, blood pressure of more than 140/90. 2, we have blood vision. 3, we have elevated liver enzymes. 4, we have right upper quadrant pain. 5, we have proteinuria, which is actually one of the hallmark symptoms, and so forth and so forth. What is the classification of preeclampsia? Preeclampsia can be classified into 2. We have preeclampsia with severe features, preeclampsia without severe features. Preeclampsia with severe features is characterized by blood pressures of more than 160/110, with those other systemic symptoms such as proteinuria of the highest grade. We have blood vision, hemolysis, elevated liver enzymes, and low platelets. We have headaches, dizziness, confusions, and all that. Yes. Management of preeclampsia, there are 4 main principles in management. 1, control of blood pressures. 2, control of convulsions. 3, fluid management. And 4, delivery. Delivery is actually the definitive treatment of preeclampsia.